Heart disease is a very common occurrence, and I'm sure you possibly have had one family member or somebody that you know that has suffered the vagaries of this disease. Today we are going to take time to study heart disease and how stroke and how it relates with nutrition and what is it that you can do to keep this off and make sure that you are healthy, at least for the longest that is possible. With me is Dr. Eddie Ramirez. Dr. Eddie is a lifestyle doctor. He is an international speaker and a researcher. He loves what he's doing, and you can see that from what he shares with us. I also have a live audience with me who are going to engage us during our Q&A session. I'm your host, Gladys Ombongi, a Leo consultant, and this program is Afya, where we learn all that we can ever do to change our lifestyle. You're welcome. Daktari, tell me, how many Kenyans do you think would be affected by stroke and heart disease? From the research that you're doing, you can actually tell.
Yes, actually, I want to show this graphic on screen. And you can see how heart disease is a very, very common problem worldwide. Mm-hmm. But when we come to Africa, then suddenly that pattern seems to be disturbed. And that's because, as we have been talking about it in the past, we have two populations in Kenya. So the people that have big needs, usually heart disease is not a problem. Sometimes it is, but in the majority of the cases it's not. But when we start seeing the people that actually are doing well economically, mm-hmm. Sadly, heart disease tends to be a very common problem. And many people may have this problem and may not even realize they have it, which makes it the problem even worse because they think that everything is fine and they don't need to do any changes and so forth. So the sad thing about it is that here in Kenya, heart disease keeps on increasing. Mm-hmm. And number two, we're starting to see heart disease among younger and younger Kenyans, which is something that is sad because, you know, for example, the last patient I saw in the hospital with heart disease, he arrived to the emergency department. 30 minutes later, he was dead. That's how dangerous heart disease is. The patient comes to us and says, "Doctor, I feel like I'm dying." And yes, it's true, they're dying. I mean, thank God for modern technology that we can do some things. Sometimes, you know, sometimes you're not able to save their life, but that's what literally is happening. You know, the heart is literally being damaged, and unless we do some intensive procedures, the person is going to die. So that's why this is such an important topic, because if we are not aware of this, our choices may be making us part of that statistic.
It's true, because I can relate with that. It's close to my heart because I've seen some of my family members actually being taken away from us, literally, because of heart disease. So what effect does diet have on this particular disease? Is there something that you can do to keep it away, or to just make sure even if you get a stroke or you are whatever stage you are in, you can actually slow down the process?
Yes, absolutely. This is not a bad luck disease. Put it that way. You know, there is a reason why our arteries are behaving like that. Because it's interesting, if you were to go back in the past, heart disease was unknown here. You know, there was only probably the king or the queen by living a very, luxurious type of lifestyle that happened to be something common, but the rest of the people didn't have that problem. So is this related to diet? Absolutely, yes. And we know that by statistics among the Westerners, you know. For example, during the Vietnam War, a lot of young people died. You know, they were young when they were sent there, 18 years, something like that. And when they did autopsy and they started checking their arteries and so forth, they were shocked to find that almost every single one of them already had heart disease.
Oh. At such a young age?
At such a young age. In fact, if you see right now on screen, we have the picture of somebody 19 years old. Is that a very old person?
That's very young.
That's very young.
True.
And you can see that he already has advanced heart disease. Okay, it's not complete blockage or anything like that, but still the heart disease is there. The blockage of the atherosclerosis is damaging many of his arteries. And look at the one in the bottom. You can see it also on the screen. 33 years old, and this lady, half of her artery of the heart is clogged in. And that's a problem, you know, that you can have it and not even realize it. In fact, children, specifically children that are fed formula, those children in their artery, you can start to see the what they call it the fatty streak. You know, the beginning stages of the atherosclerosis. This is not normal. This shouldn't happen.
Wow. Did you say children?
Children.
Fed on formula? You had it. Yes, that we actually have to encourage our mothers to breastfeed their children and not to actually put them on formula. So how do these arteries actually get damaged, doctor?
So we actually have a very good idea how this happens. So when you have the artery, the inside, the innermost layer, that one is called the endothelium. And that's the part of the artery that gets hurt. So the endothelium is a very important part of our body because the endothelium, what it does, it's where the blood passes by, it's where the nutrients passes by, it's where the oxygen passes by. So its function is to absorb those good things and send them to inside to the internal organs and so forth. So when the arteries are getting damaged, the problem with that is that you're interfering with the absorption and so forth. So what damages those endothelium? One of them is the Western diet. That's something very well established, very well documented. And that type of diet, what it does, it creates what is called inflammation. And through inflammation, our own immune system starts to damage some of those arteries, and you start clogging them up, exactly as we mentioned with those young people, as that endothelium is being damaged by the choices that we're making.
So is this always a problem that we've always had? Has it always been that way, or is it something that we just picked along the way? What do you think could have happened?
So there's actually some very interesting research. We have access to the mummies here, to your close neighbors here, the Egyptians.
Yes, sure.
And you know, one thing that the Egyptians did a good job was mummifying people, you know. So we have a nice conservation of those bodies that we're able to study. You know, today we have the technology to, as the way that we do diagnosis on living humans, we can actually diagnose those mummified bodies. Now the question comes, who were those people being mummified? Were they the average common person? No, isn't it? These were the elite of the time, the big businessmen, the kings, the pharaohs, the people in the court, and so forth. So by living that type of lifestyle, when they analyze these mummies, you find very commonly atherosclerosis. Okay, so it's interesting that in the book of Exodus, the Bible says that if we are obedient to his guidelines, we won't have any of the diseases of the Egyptians.
Yes, Egyptians.
They
say.
mention them by name.
Yes.
That means that it is not the will of God that we have this problem. Therefore, I'm very glad that you are listening to this program today, because you are going to learn, how to make better choices to avoid this type of damage to your arteries.
So we can safely say that it's not a modern disease. It somehow has been there for a long, long time.
Yes.
And there is something that we can do. There is something we can do to reverse it. Do you want to take us through that?
That's right. Well, what we need to understand is where this came from, so the issue is there is an important component by the name of oxidized cholesterol.
Super.
So oxidized cholesterol is what really damages our arteries. So basically is as if you leave your bicycle outside in the in the air and rain and so forth, you are gonna get your bicycle oxidized.
Yes.
So
elements.
what oxidizes things? When we put cholesterol in the environment, that oxidizes the cholesterol. So oxidized cholesterol is extremely toxic to the body. So when the oxidized cholesterol is circulating around the blood, we have like policemen that we have in the roads here. There's policemen, there is immune system, just keeping an eye that everything is fine in our arteries. And every time one of those oxidized cholesterol comes in, the immune system goes and eats it. Now, this is so toxic that the body cannot just get rid of it. The cell that ate it is gonna die, and it's gonna start to accumulate. So if you were to eat oxidized cholesterol, once a year or something like that, it's not that big of a deal, a few cells and so forth. But oxidized cholesterol breakfast, oxidized cholesterol lunch, oxidized cholesterol in the supper,
Yes.
we get ourselves in big trouble. So where is this coming from? Animal products. Animal products have cholesterol, and when we expose them to air, that creates a problem. Very interesting study that was done. For example, who has more cholesterol? Mother's milk or cow's milk? It ended up being that human milk actually has higher levels of cholesterol. Wow. But the human milk is not going to damage the arteries of the baby, because the human milk comes straight from the breast to the mouth and boom, no time for oxidation. But what do we do, intelligent humans? Take that cow, out, the milk, and then we drink it, after we expose it to the air.
Yeah.
So if you want to eat, cow's milk without cholesterol, you have to hang from there, Of course, for some hygiene issues may not be the best thing to do.
So are you saying that if you want to have it unoxidized, then you've got to get it straight from the udder? Wow. I don't think that's something I would like to do. And that brings us to the first half of our program today, so please don't leave. We will be right back after the break.
The arteries happen to be the combination of custards. So when you combine eggs,
Yes, egg,
milk, and sugar, sugar oxidizes even more the milk. So that is a bomb when you eat this, which sadly, this is what many people like to eat, in the hot days as a form of ice cream. That's what ice cream is, it's sugar and milk. Sadly, that is the breakfast of many people. You have cereal that has sugar, and then you put cow's milk, and then some even people even add even more sugar to it. you're basically even oxidizing even further. So that's one of them that came out in the study. Second,
before you move to the
yes.
second one, that's interesting, because egg, milk, and sugar is even a perfect recipe for what when people are making cake. That's what we do.
That's right. That's right.
We actually do that all the time, or some kind of custard.
Mm-hmm.
Does the stirring make it more difficult? Does it increase?
Well, it will increase it because you are creating more of that bond between the sugar and the milk and the egg. You know, that's a wrong thing to eat. You know, if you want to have clean arteries.
Yes.
So the other one that they found out among these monkeys was pancake mixes. Why is it so harmful that? And that's because if you see among the ingredients of those pancake mixes, it is pulverized egg is one of the first ingredients there. So what are we doing? Every single particle of egg, we are exposing it to the air, effectively, you know, oxidizing that. That, by the way, this happened to be, I noticed something common here in Africa. Powdered milk is the same story. Powdered milk, you're getting every single particle of the milk, exposing it to air, oxidizing it effectively. What other food they found out that was extremely harmful to the arteries of those monkeys? Parmesan cheese.
Oh, okay.
Because as you are, you know, breaking down that cheese, and also the process by how the cheese is made, you know, in that consistency and so forth, it is very much exposed to air, and also is very oxidizing. And the fourth food that was extremely oxidizing was pig's fat or lard. You know, that is something that you should not be eating at all. That is tremendously harmful to your arteries. Just think about it. If you ever seen how they make this, you have the pieces of the fat of the pig that are being boiled. So think about it, you know, it's coming up and down and up and down and up and down, and effectively, you know, creating something very, very harmful to your arteries.
I've heard four things, and I'm thinking these are very common foods that we find in our market today. Because powder milk, we have lots of powder milk. We use it, we reconstitute it in our kitchens. People do that all the time. So that is a perfect recipe for oxidized cholesterol, which you don't want to have in your diet. And perhaps this would even explain why some communities that consume, particularly here in Kenya, we have some communities that consume a lot of powdered milk. Because of, you know, you have to take tea all the time, so they keep preparing tea. So I really, I'm learning something, and this is very interesting. So what is it that we can do to prevent this? What is it, apart from getting rid of this, is that all?
That's right. Yeah, so basically what we need to do, we need to have a artery-friendly diet. And that basically consists of a whole food plant-based diet. So a whole food plant-based diet does not contain cholesterol. Therefore, there is no problem with the oxidation of it, because there's none of it. And studies have shown, such as Dr. Esstill, he published quite a bit on the subject. I'm co-author with him in a nutrition book. And he showed that people that are following the whole food plant-based diet, that is wholesome, that is whole, and rich in nitrate containing vegetables, created, when you eat a lot of nitrate containing vegetables, such as green leafy vegetables, such as certain roots, like the beetroot and so forth, what it does, it starts to heal your artery. You can actually see that on the screen. And that type of diet will start healing your arteries. In this study, what they did, you can see how the artery starts nice and thick and then suddenly becomes thin. That is the plaque of atherosclerosis blocking there. And in this study, 36 months, using the whole food plant-based diet, very strict, absolutely no animal products, no caffeine. He takes people out of caffeine, also absolutely no source of caffeine that will damage your arteries. And you can see without cholesterol lowering medication, the arteries of the heart start to heal, And this is not only one case, there's actually multiple cases that he published showing, how that reversibility is possible.
How long would it take someone to actually have whatever the damaged arteries to just get the plaque off? Or
That's right. So you have two subgroups. That's what the studies show. One group will actually stop the damage, which is actually good news. If you can just stop the damage, that's good news. In another subgroup will start to, that process of healing through the HDL and different processes. The body starts removing some of that plaque. Dr. Dean Ornish did some very good studies in a published clinical trial called the heart trial. And what he did, he was measuring how much blood is reaching throughout the heart using tectonium, a radioactive element. So he was able to demonstrate, at the beginning of the study, how there's many parts of the heart that were not getting that blood flow correctly, and therefore that's why the patient manifested this as, pains in the chest and so forth. And in a matter of weeks, it doesn't take years, in a matter of weeks,
wow,
you could see the increase of blood flow to the heart, meaning that those arteries were starting to heal that fast.
So it would just take a few weeks.
That's right.
For some people, of course, again, depending on how much damage there has been. Would this help someone who has actually, let's say someone who has experienced a stroke? Does this also apply?
Absolutely, absolutely. Somebody that's experienced a stroke. There's many different types of stroke, but many times one of the issues that triggered that stroke was that the arteries of the neck became clogged, and then pieces came out of those plaque, and that went travel to the brain, and boom. So the brain itself, when you damage it, the part of the brain that got damaged, it's damaged. You cannot do anything. But the arteries that go there, you can start the healing process. We had a case like that. We had this patient. He had severe atherosclerosis to the arteries that go to the brain. And the doctor told him, the cardiologist, I'm sorry, there's nothing we can do for you. It's too dangerous to try to clean that. We can release clots and give you a stroke. You better settle things at home because you're going to die very soon. He had an 85% blockage when he came to us. And he stayed with us like a month and a half. And through the whole food plant-based diet, the exercise, stopping the caffeine, resting enough, the prayer, and the whole package. When he went back, when he finished the program, at the beginning, he was just able to walk a little bit. He left the program running kilometers.
Yay, nice.
That's how well he was feeling. And when he goes back to his cardiologist that, gave him basically the death sentence, he was shocked. He said, I have never seen this, The reversal of the atherosclerosis started to take place. And he says, whatever you're doing, you keep on doing. That's exactly what you need to be doing. Actually, the cardiologist learned. He didn't know about the lifestyle interventions, and he even wrote a nice article in the newspaper there documenting the miracle that he just witnessed through the whole food plant-based diet.
Wow, that is so good to know that it shouldn't be so early to pass the death sentence and say you are done. We make peace at home. That reminds me of something I came across. Somebody was asking, I can feel something here, an artery, and a blockage that is on perhaps in some artery. Would you tell them, or would they be encouraged to do something about it? Because we find most of the time in our rural places, when someone feels something, we have a tendency to massage it.
Okay.
Or to do something, to make sure you get rid of it. What do you have to say about that, doctor?
Yeah, and that is so simple. This is not an expensive study or anything. A simple ultrasound of those arteries will quickly tell you if what you're facing is, atherosclerosis, or if it's a nerve or muscle or something else that you can massage. That would be good if you can massage. If it's a muscle, that's right. But if it's the artery, that's the last thing you would do. If you're poking there, you can break part of that atherosclerosis, and you can get yourself in really big trouble. And in fact, this is one of the problems with heart disease. See, the symptoms of heart disease will appear when there's a blockage of about 75%. So you can have very severe blockage. You can have 50%, 60%, and you think that everything is okay. No problem. I can continue living the way I'm living. But once the blockage is almost 80%, 75%, that's when the angina starts coming up, the pain in the chest and so forth. So we need to be able to do something before time. And I have some published research on the subject. For example, you can see that a study that I published on the screen, in which in a matter of 2 weeks, both cholesterol and LDL cholesterol was coming down significantly by switching those patients to the whole food plant-based diet and stopping the coffee. Not only that one, this other one also, this our program of 18 days in Weimar, California. Same story, the whole food plant-based diet. As we measure the before and after, tremendous change in the cholesterols without statins, the medications that lower the cholesterol. And this last one, this is actually when I was a medical student, I did this study. I had a group of patients that I wanted to lower their cholesterol. My advisor, the one that was helping me with the study, told me, Ramirez, don't do that study. You're going to waste your money. The cholesterol doesn't go down unless you use medication. I told him, look, it's my money. I want to do the study. So I went ahead and did it. And I can tell you, every single one of those participants, in a matter of 2 weeks, the cholesterol came down. This study came out in a Lipids magazine. And if you want to access this research, just Google Francisco Ramirez ResearchGate. That's where all this is archived. You can read it there for free.
Now, there's something you've mentioned, Doc, that I would like us to just touch on a little bit before we wind up. You said about the medication, for the cholesterol medication, and many a times you find people are actually told you have to use this cholesterol medication. Is it as effective? And does it do the same work as a whole plant food-based diet?
It does have some benefits by the fact that it actually helps reduce a little bit of the inflammation. But a nasty side effect that this medication has, which many times is not told to the patient, is that medication damages a lot of the muscles. So you start actually promoting muscle atrophy. That's the last thing I want to have as I get older. So in parentheses, if you really need to take one of those statins, well, you need to take it together with a supplement called coenzyme Q10 that you can find here in Nairobi,
yes,
if you look around. So wherever you take one of those, you take one of those capsules, and then you take the medication to lower the cholesterol. So the answer is actually a no. The plant-based diet actually has even further benefits compared to that, and it is cheaper. Those cholesterol-lowering medications are not the most cheap type of medication. So I would suggest, to rather switch to that whole food plant-based diet.
Thank you. Thank you very much, Doctor. We now are better informed, and we now know we can do something about it. It's cheap, it's affordable, it can be done. And we can prevent this from happening in our homes and in those people who are around us. So we're going to take a short break, and we will be right back. Welcome back. We are so glad you're still here with us. And this is Afya Fix. And I am your host, Gladys Ombongi, a nutritionist at Lisha Leo. And my guest is Dr. Eddie Ramirez, a doctor of lifestyle medicine and an international speaker and researcher. We also have a live audience. And it is our time now to hear what questions they have for today. If you're joining us for the first time, we're so glad you're here, and we're glad you'll always continue to stay with us. Over to you, our first question.
Thank you so much for this opportunity. I'm learning a lot. I was just thinking, how is deep venous thrombosis related to heart disease?
Okay.
And also, the other question is, what causes blood clots? I'd like to understand what causes blood clots, because I've heard of people who woke up in the morning, went to work, and died at work.
That's right.
Yeah, they just fell down and died. I'd like to understand more about blood clots.
Sure.
Yes.
Yeah, that's actually an excellent question. So, deep venous thrombosis is what's happening there with those problems with the varicose veins. That tends to be a more common problem among females, even though males may not be exempt. And basically what's happening is that the arteries of the venous system of the legs, they have a mechanism to help us send the blood up. It's a bulb like this. So what ends up happening is that those bulbs get damaged. So instead of the blood being able to go up, what ends up happening is that there is a collapse there, and blood doesn't circulate correctly. Therefore, the probability of the blood clotting and causing different problems. So what can we do? Number one, even if you come from a family that this is common, because there's a little genetic factor here, you have to do exercise. There are 3 things that help move those veins, that venous blood, and that is exercise. The second thing is gravity, raising your legs, and the third thing is massage. But by having a regular exercise program, you're able to move that blood and decrease the likelihood that varicose veins may be becoming too complicated and so forth. Now, what causes blood to clot? That's actually a little bit of a complex question, because it's many things. It's not just one thing, but we can talk about the most common ones. The most common cause of blood clot actually happens to be not drinking enough water. See, when you are not drinking enough water, the body, is not able to dilute things and so forth, and you can get yourself in trouble. You actually increase your risk of a stroke, of a heart attack, if you are somebody that does not drink enough water. So make sure you drink enough water. How do you know you drink enough water? Your urine should be nice and clear, without a heavy odor and so forth. Also, another relatively common cause of clotting happened to be something genetical. There are some people that have that predisposition to clot due to some genetic mutations. You inherit this from your family, and there's different severities. Some of them are very mild, some of them tend to be more severe. So if there's a lot of clotting in your family, it will be a good idea to investigate this a little bit further to avoid this type of problem. And number 3, inflammation in the body can cause clotting. When I'm very much under stress, after I ate, that chicken, fried chicken, and this type of thing, that's very inflammatory. It's more easy for the blood to clot under those stages. If I'm somebody that is not sleeping enough, watch out for that. If you have cavities and gum disease and you're not treating that actually increases your risk of clotting through inflammation. And also excess consumption of sugar that actually also increases the risk of clotting. So as you can see, those are multiple things that we can identify and try to make those changes to avoid, getting ourselves in trouble.
Wow, that's deep, and it's a little bit outside what we're discussing, but definitely highly related. Let's see our next question.
Yeah, thank you very much for that explanation on the stroke and cholesterol. Just some more clarity on cholesterol. We have learned more about the cholesterol that gets into the arteries.
Yes.
What about for people who present cholesterol around the heart? Because I've seen patients where the cholesterol is covering the heart outside, not on the arteries.
That's right.
How would the plant-based diet also assist?
That's right.
And also the myth about taking the lemon, whether it's a myth, I don't know, but whether lemon water, taking warm lemon water helps to clear the...
That's right.
So the plaque, yeah.
That's right.
Yeah.
Good. Those are very good questions. So this is something very interesting. When you're doing a study of the heart, specifically the arteries of the heart, and you find atherosclerosis there, it means you have atherosclerosis all over the place. In fact, a wise physician knows the following. If a male above 50 starts having problems with sexual dysfunction, one of the most common causes happens to be that the pipes down there are getting clogged in. And if those are getting clogged in, your heart is also a huge risk. Those people that start like that, in a few years, they're going to have a heart attack unless they make severe changes. So you need to understand that, we're a whole part, so it's not just one part and so forth. Everything is interconnected. That's the reason why the famous sildenafil, this Viagra medication, is such a big seller.
Yes, it's a big hit.
Because exactly of that. See, as those blood vessels are clogged in, that is exactly what Viagra does. It artificially opens things up so that there's more blood flow. And in the same way, you're actually not solving the problem with the Viagra. You should go urgently to that plant-based diet because, we want to open those arteries before this causes, a major problem like a stroke or a heart attack. So yeah, the answer is that yes, the body is able to start that healing process, specifically on the heart. Sometimes also, if there is too much fat consumption, there start to accumulate fat inside the internal organs, and sometimes you can observe that the heart gets this heavy type of fat layer around it, and this actually predisposes to insulin resistance. So by solving the issue, which is overweight, and decreasing the weight, yes, the body is able to also remove some of that excess fat from the heart. And the lemon, that is an excellent placebo option. Okay? If you want something placebo, you can do that. And see, that's the issue. People want shortcuts. I don't change my diet. I keep eating, my fried chicken and my steak and my milk, and I just drink my water, lemon water in the morning, and that should take care of it. It doesn't work like that, You have to deal with the root cause of the issue. Problem. You have to stop putting that cholesterol in those arteries. Then the reversal of that atherosclerosis can take place.
Okay, so no shortcut. No shortcut. Let's have the next question.
Thank you. Thank you so much for this lesson. Two things. So you talked about cooking with a cooking spray.
Yes.
If you want to avoid oil.
That's right.
And I read somebody, I don't know whether it's a doctor or some person online, discouraging that. So are there some brands that are good, or was it some misguided person? Then secondly, honey versus sugar. So we stop taking sugar, we move to honey. Does it have the same challenges to the body.
Good
And
question.
alongside that, speak to the whole issue of fatty liver
Yes.
and the honey,
Good
sugar.
question.
Yeah, thank you.
Okay. So yes, the issue there with that spray. I mean, I don't sell this or anything, but the brand that started this was a brand by the name PAM, P-A-M. Now there's other generic versions, and they're as good as that. You don't have to buy the PAM. If you have issues with cholesterol, I would even avoid the one that is from coconut oil. There's one that is with coconut oil. I would avoid that one and take the other one, you know, the canola or olive or whatever option you may have locally. So yeah, that's not that big of an issue. And yes, regarding the issue with the fatty liver, you know, what's the problem there, you know? So basically, that is a sub-cousin of insulin resistance. What is happening is that you are taking too much fat, you know, and usually a lot of saturated fat combined with not enough exercise. The body liver takes care of some processing of the fats, but you're putting so much fat that is getting stuck there in the liver and starts to accumulate. And that starts to literally damage your liver. It's something extremely harmful to your body, to the point that you can end up with the same liver of a severe alcoholic if you have the fatty liver disease and you don't deal with it. What do? Simple recipe: whole food, plant-based diet, exercise, avoidance of any type of alcohol, any type of caffeine. That is the best recipe for that fatty liver. And regarding that honey question, you know, should we switch to honey and so forth? Well, definitely honey is a better option by the fact that there are more nutrients when you eat honey compared to the sugar. But the Bible is clear. The Bible says a little bit of honey is good for you. Notice the a little bit. Okay, so it's not saying, you know, take the whole honey and pour it there on your fruit salad and so forth. You know, you need to remember that honey happens to be a high caloric food. You can actually gain weight from taking too much honey. So just a little bit, you know, just to give flavor, that's completely fine. But yeah, watch out with the excess honey, you know, because of the caloric issues.
Thank you. Thank you so much for that. We can have another question.
James Omoyo. My questions are on oxidative cholesterol.
Yes.
When a mother decides to express a milk and then put it on the refrigerator, will that be okay? And then my second question is on exercising. Can you please tell us something on that, especially when people have issues like stroke?
Okay, good. So yeah, first question. What about those mothers, you know, because of work and different issues, they need to, you know, extract some milk and then put it in the fridge and so forth? Yes, there's a little bit of oxidation, but not as much as oxidation from the cow's milk. See, if you buy cow's milk, how come the milk doesn't separate like in the old days? You know, in the old days when you milk the cow, the milk would separate. You know, you had this solid white part that stays in the bottom, and then this more liquid part, more transparent, that goes in the top. Why does milk today does not separate? Because somebody that thought that he was very smart made the following thing. They send that milk through high pressure, and that effectively mixes those two parts, and that's why your milk doesn't separate. But you get yourself in trouble. Because what are you doing? Every single particle of the milk now, you are exposing it to the air, so you are tremendously oxidizing that milk. So that's why yes, there's a little bit of oxidation that takes place on the mother's milk, but it's not as much as the one that you buy in the store. So yeah, I would say definitely, you know, give that milk to the child, you know, no problem. If that's the situation, you know, that you need to be using, definitely it's much better, you know. And the second question about exercise, you know, and I want to clarify this. This is actually a very good point. Some people think that, oh, you know, I'm going to eat the junk that I want and I just exercise and that's going to clear my arteries and so forth. That is not necessarily true. In fact, if you're that type that things like that, I'm going to give you homework. Look for Jim Fixx, F-I-X-X. Jim Fixx was somebody that made popular running in America. And the guy has a very interesting story. He was a couch potato, no exercise or anything, depressed and sad and no hope in his life. And one day he saw a racing on the TV and said, you know what, I should start exercising. So he started exercising, and very soon he was able to run the marathon and all kinds of things. And I remember one day a reporter came to him and asked him, you know, from all the things, benefits of running, what do you love the most? He said, I love the fact that I can eat whatever I want and it doesn't matter because I do exercise and that clears up. Did you know that the famous Jim Fixx died of a massive heart attack one day while exercising? Not because actually the exercise, but rather the junk food that he was consuming. He was damaging severely his arteries. And no, there's no shortcut, you know. You cannot say, oh, I'm just going to bypass, you know, the diet and I'm just going to do the exercise. It doesn't work like that. You will get yourself in really big trouble.
Wow. There is no shortcut. So we can't eat what we want, then exercise it away. We've got to keep up and do that which we ought to do all the time because our body has a way of keeping a good record of it. So you can follow up this discussion on Twitter at Hope_Kenya. Also on our Facebook page, Hope Channel Kenya. You'll find this. You can put in your comments there. And you can also view later on our YouTube channel, HCK. And you'll find all this recording there for you to view and for you to discuss and share with us. And also on your screen where the numbers are displayed, you can reach out to us. You can be part of this live audience and also get to ask your questions. So we are so glad that you were able to be with us and we're so thankful. Thank you so much, Daktari, for being part of this. We are really thankful.
Karibu.
We had a very lovely and lively audience as well with lots and lots of questions. Thank you so much. And I am your host, Gladys Ombonge. I'm so glad and I'm so thankful that you have been with us all this while. For now, it's goodbye. Asante sana.